let's talk about pain while having sex. What can be the possible causes and what are the red flag signs when you should report to a doctor? So when we talk about pain while having intercourse, the medical term for it is dyspareunia, and there can be some physiological structural causes and sometimes there can be some psychological causes which needs to be addressed. Now, pain can be at different aspects of having intercourse. It can be during penetration or it can be throughout the act. Sometimes there can be intense burning, itching post the intercourse, and sometimes there can be pain which can last for hours after having intercourse. Now, there are different causes which are there, like coming to physiological or structural causes. Lack of lubrication is one of the cause. In fact, it is one of the most common cause. There can be some local trauma, some injury. There can be some inflammation, some infection which is causing it. And of course, the most talked about vaginismus is also one of the cause for having painful sex. Now, other deep-rooted causes can be endometriosis. It can in fact cause pain which lasts even hours after having intercourse. And there are some structural defects which are present from birth, like your transvaginal septum. Sometimes there's a developmental defect. There can be vaginal agenesis, and all of this can also cause pain while having sex. Now, the most important thing is, and we should not forget to address the emotional or psychological aspect. Sometimes there can be a history of sexual abuse in the past which can cause aversion towards sex. Sometimes there can be some stress. Sometimes we have a false body image, or we are some females ashamed of their bodies. They are not comfortable with their bodies. Sometimes they're not comfortable with any particular partner, and all this causes stress, which ultimately causes contraction of pelvic muscles and can cause pain while having sex. Now, there are some factors which you can actually figure out yourself and can work upon it with after having talks and discussions with your partners. But at times when you're not able to find the cause, I believe you should not ignore it, because at times there can be some structural aspect which needs to be taken care of. And most importantly, there's some psychological aspects which really needs to be addressed by an expert. So whenever you have some problem and you think that there could be some underlying cause for the same, please consult a doctor. Thank you.